Hey guys, welcome back to the channel. Today we want to talk about the magnitude of infertility. What are the causes? Are there possible solutions? And there is no better way to have this conversation than have it with a fertility expert. So keep watching. Today on the channel we have Dr. Muyingo here. Welcome to the channel.
Thank you, Lisa.
I'm so happy and excited to have you.
I'm happy to be here too.
So just introduce yourself, let the people know who you are, how long have you been in this practice, and then they can get to know you better.
All right. I'm called Dr. Muyingo Mark. I'm by training an obstetrician and gynecologist, but I've had extra training in reproductive endocrinology and infertility. I'm the managing director of Neogenesis Fertility Center on plot 120, Bokoto Street. I have been in this fertility treatment since maybe about 20 years ago, 2007, up to now. And we started Neogenesis about 5 years ago, majorly to make a difference, because we wanted to have a patient-centered treatment. So here we are, and we're doing that right now.
Wow, amazing. And we are here at Neogenesis, and when you hear everything, you will know that this is the right place for you. Yeah. So I just want to know, what are the major causes from your experience of infertility that you have seen?
Okay, infertility, maybe just to give a little bit of a brief, is the inability to conceive when people are trying for a period of about 1 year. And we know that this trying should be regular sexual intercourse. So the couple should have regular sexual intercourse for a period of 1 year before you can say that, well, they need to have they need to get help. And but if the lady is above 35 years, we reduce that time to about 6 months so that we can start the investigations a little bit earlier. And we'll talk about maybe later why age is very, very important to a lady in terms of conception. So the causes of infertility are quite many.
Yeah.
They are very, very many. But they can be categorized in about 2 ways. We have those that are genetic, that you're born with. You have no control over them. And there are those that are acquired, that you can do something about. For example, in the genetic ones, we have some of the people who are born with some needs, you know, the special needs people.
Okay.
Sometimes those people also have reproductive problems because they have some genetic problems. We have some conditions we call, for example, Klinefelter syndrome, Turner's syndrome, so many syndromes that we have in whatever. They have a number of symptoms that they show you and you say, this person has that.
Yeah.
Those are acquired. But also polycystic ovarian syndrome is also a genetic problem.
Really?
Yes. The people who have that have a genetic predisposition. For example, you might find that your mother has polycystic ovarian syndrome. And maybe you have, and your sister doesn't have. Or you might find that your mother doesn't have, but your grandmother had polycystic ovarian syndrome. So those people usually have an issue with the way that they use insulin in their body. They have insulin resistance. And because they don't use insulin well, insulin doesn't actually enter well into their cells. So there's a buildup of glucose in their bloodstream. Now, when the body sees a lot of glucose circulating, it thinks that, no, this is excess. So it will store it as fat. Okay? So these people are prone to putting on weight very easily. And so we always advise, when we make a diagnosis of polycystic ovarian syndrome, we tell them you need to make sure that you keep healthy. Because you're likely to put on weight. So that genetics, polycystic ovaries is in there.
Is one of them.
Even when now we cross over to the acquired, obesity or a lot of weight is a very big problem.
How?
Now, when we talk about weight, we always have a measurement of someone's height to someone's weight.
Yes.
We call it a body mass index.
BMI.
There's a calculation, the BMI. So the normal BMI for everyone should be between 20 to 25. When we do the calculations for your height
and weight,
should be between 20 to 25. But for fertility, if that BMI goes above 30, then you start even skipping periods.
Oh.
Okay? So weight, even for men, you start getting low sperm quality when you become obese. So it's very, very important that we keep ourselves healthy. We go to the gym, work out, eat healthy, eat well, and make sure that we keep ourselves well. Also in the acquired, we have infections.
Okay, which kind of infections?
So these infections that we really play a very big role are infections that are sexually transmitted. Unfortunately, some of them that are very, very deadly are things that will not cause any problem when you are getting the infection. The one that I talk about majorly is chlamydia.
Okay.
Okay. So chlamydia is called a silent killer. Because it will come, you'll not know whom you've gotten it into, because, you know, when you're young, you might have a boyfriend and whatever. You know, when you're younger, a lot of stuff can happen.
Yeah.
And so someone might have chlamydia, gives it to you, you don't know, you try to get ready for conception, and your tubes are blocked. Okay? And it's something that happened 10 years ago. It came, did its destruction, and left.
Wow.
And well, you cleared it with antibiotics, so it went away.
But there's an effect.
But the effect remains. Okay? So there are a number of things. And we've talked about also our lifestyles, the environment where we work. For example, the people who work in blast furnaces, like, I don't want to mention that, but where they do, for example, steel rolling, they do what? Those blast furnaces, they produce a lot of heat. It's not very good for men.
For men?
For men, because heat is a big problem to the whatever. And of course, the things that the other causes can be drugs, for example, that we're using, maybe you're treating high blood pressure, diabetes. Sometimes the conditions that we can have, for example, like the men can have some swollen vessels in their scrotums, they're called varicoceles. All those can cause problems in the men, and of course for the ladies, for the couple to have a baby. And but they're majorly divided up in about 3 areas. Those causes that can be brought on by the lady, the causes that can be brought by the gentleman, or the husband, the spouse, and those causes that have both of them combined. And then there are those that we say we don't know. Those are the unknown causes.
You mean you can be there and you don't know what's causing someone?
Yes, you do all the investigations and you find that everything is
okay,
but they're not conceiving. We have ideas about what it could be, but well, they are termed as idiopathic or unknown causes. So the causes, you know, in reproduction, the way that the body is controlled, everything starts from the brain. Okay. There is a place in the brain called the master gland, or called the pituitary. That is where all the signals that are helpful in our reproduction come from. So these signals go to the ovaries or the testis in the men, and they command the ovaries or the testis to make eggs or to make sperm. Now that signal, the ovaries or the testis will start making the gametes, but they will also send back a signal to the brain that the eggs have actually been made. So that now the body can say, you can have those released, for example, for the egg, that you can ovulate, and for the gentleman, they can be kept for the time that they need to be used. So you can get problems that start from the level of the brain. You can get problems at the level of the ovaries or the testis. You can get problems that come from the uterus, where the baby is supposed to sit, or even those areas that are supposed to transport the egg and the sperm. So they're quite a number.
They're quite a number. And how can I, like, if, you know, sometimes, like you've said, by the time for someone to say that I have a problem, it takes like 1 year of sexual intercourse and you deliberate about it. Is there a way I can know before? What are some of those signs that may trigger me to know that something may be wrong before I actually go there?
Okay, thank you very much. Now, when we are all growing up, there are some things that we notice about our bodies when we reach maybe about the age of 12, 13 years old. Some people it's a little bit earlier, maybe 10 years or 11, but other people it might be a little bit later, maybe 12, 13 years. For the ladies, you will start seeing your breasts develop. You will start getting a nice body shape, and you will start being very cautious about how you look.
Yeah.
Those are some of the signs that you can see. If someone doesn't care about themselves, you don't even have any of these things around you, and yet you're a lady, then you know that there's a problem. That's as early as you can know there's a problem. So you have to have that attraction, even to the other sex. Okay, you feel shy, you know, about some things.
Yeah.
And so that really tells you that yes, my hormones have kicked in. They have started working.
It's about hormones.
It's
I was
about
trying
the
to see
hormones.
where it's related.
Yes,
Hormones.
it's about the hormones. And for the gentlemen, our voices break.
Yeah.
We start getting a little bit more aggressive. We get beards and other things, and of course the things that happen that people have always talked about. You know, having you know, erections, for example, in the morning. Don't beat your son or daughter up because the son that they've had an erection. That's a natural normal thing that it has to happen. I mean, it shows that the body is working well. But of course, as a couple, when you have been deliberate about it, of course, the other thing is that when you get married or you were with a partner, you need to, of course, be able to have sexual intercourse. So if you feel that that's not something that interests you and you're married, then there must be a problem, because you should be interested in doing that. You're deliberate about it. And so when all that is done and you still cannot conceive for 1 year, the World Health Organization says then you need to seek care. Yes.
I have had lots of people talk about things like irregular periods, you know, for the ladies, that could be a sign. Then something that has been coming up a lot called PCOS.
Yes.
What is that?
Okay. So, yes, irregular periods. Maybe one thing that I forgot to mention is that for a lady, if you have, after maybe 16, 17 years, your periods initially are a bit irregular because your whole system is trying to start up. But after 18 years, your period should be regular, that you get a period every month, okay? As long as it's every month, that is okay. You don't have to be exact on a date, that I get my period every 30th or 30th or something like that. But it comes every month. That's regular enough. So regular periods is equal to ovulation. Because periods is a sign that that month, the preceding month, you actually ovulated, but did not conceive. So that's why you get a period.
Yeah.
So in some of the conditions, and one of them you've mentioned is polycystic ovarian syndrome, we have a problem with ovulation. And the issue is that it's a syndrome where they have very, very many eggs. But these eggs compete with each other to grow, and they sabotage each other. So none of them comes out as mature enough for ovulation. At the end of the day, because none has come out as mature for ovulation, you will not get periods because you have not ovulated. So they get irregular periods. And of course, they have some other signs and symptoms that we can see from. They might have a little bit of more excess body hair. They might have a little bit of acne and other things that we can see when we do ultrasound scans and hormones. But it's something that can be treated. We have quite a number of people like that at Neogenesis, and we've helped quite a number of them. You just need to seek an expert, and they will be able to sort that issue out. There are quite a number of people who have polycystic ovaries. Yes.
So from your experience, the number of people that you've worked with, would you say that how many people, let's say how many women are infertile? Like when people have come to you, you can be saying maybe 1 in 4, I don't know.
Okay. First and foremost, I'm not the right person to ask that question because the people that I see are majorly people who are trying to conceive. So I'll tell you it's 100%.
Oh, they're already, okay.
However, we have some things that we know is that human beings, we are relatively infertile when we compare ourselves to other human beings, to other species. For example, what is some condition, something they call fecundity. What is the ability of someone to conceive? They're young, someone is ovulating, and they have sexual intercourse at a particular time that you expect they're ovulating. For human beings, what is the probability that the person will actually conceive? It is 22%.
What?
It's as low as that. Okay? So you need to do it repeatedly. That's why we say regular sexual intercourse for you to increase your chances of conception. Of course, these are things that they tell us, but there are some people who say, oh, no, every time I want to have a baby, I have a baby.
Yeah.
Yes, that is you. But generally speaking, the number of people who need to do it a little bit more to be able to have a baby. So it's about 22%. But then, WHO, that's the World Health Organization, says that, and we're not talking about ladies only, we're talking about a couple, because it takes two to tango. Now,
Right.
They say initially it was about 1 in every 10 couples. 1 in every 10. Now, currently, the current data coming out is that 1 in every 6 couples has a problem of conceiving. So we need to give it a little bit more attention because a lot of people struggle with this issue, and it has a lot of psychological, social impacts. And,
that's true.
In the community.
So what do you think has caused that number to increase? Because from that to 6, 1 in 6, that's, alarming. What's that?
Well, so there are a number of issues that have basically come up. With still as we go ahead with modernization, so many things change. We have a lot of things that they talk about now, diseases of lifestyle that have come up. We have a lot of things that we eat, for example. A lot more people are becoming obese. The things that we use, all those can affect your fertility. For example, we buy tomatoes from supermarkets, and these tomatoes come from somewhere, and we sometimes use pesticides to spray these tomatoes. These pesticides have been known to be reproductive toxins. The cosmetics that we use, we need to look good.
We need to look.
But at the end of the day, some of them, especially if they come into the country unregulated, can cause a lot of challenges to reproduction. And also things like, for example, Bovera. Bovera have something called xenoestrogens. These are estrogens that can affect your fertility. And someone has problems with ovulation. So there are quite a number of things. So modernization has brought a lot of things. And we don't eat well, we don't sleep well, all sorts of things. So all those affect reproduction.
Oh, wow. That's just interesting to know. So guys, just stay woke and make sure that you improve on the lifestyle. I think even nutrition comes in there and things like that. There's something you mentioned. You mentioned, of course, the things we use. Now, for ladies, so many people have concerns when it comes to family planning. Does it actually affect our ability to give birth?
Okay, family planning or contraceptives?
Contraceptives, actually.
The contraceptives that are used will not have an impact on your reproduction. The only thing is that you need to seek expert care to be able to choose for you a contraceptive that works for you. Not every contraceptive works for everyone. We have what we call a medical eligibility criteria for contraceptive use for particular ladies or gentlemen. There are some that are universal, that you can all use. There are some people who, for example, react to condoms.
Yes.
That is not something, might have think it's universal, but there are people who can't use that. They have allergies to latex, and so they can't use that. So you seek attention, and they can choose for you a contraceptive method that works for you. Although we know that there are those that might give you a little bit of challenges conceiving later on, because they might take a little bit more time in your body, but after some time, give it some bit of time, they get out of your body, and you can be able to conceive. But of course, the issue about contraceptives majorly is that people, when you stop worrying about getting pregnant, you stop worrying about other things, okay? So for example, where you would have needed to use barrier methods with a number of partners, you don't use the barrier method because I can't get pregnant. But you can get sexually transmitted diseases.
True.
And those can lead you to not being able to conceive at the end of the day. And you say, oh, I was using this contraceptive and now I can't conceive. And you think it's a contraceptive. But actually, it was your lifestyle after use of the contraceptive that might have brought you problems.
Amazing to hear. Now, we've been talking about couples. It takes two to tango. So many people focus on the woman. We're always saying it's the woman, you're barren, etc. Do men also cause this infertility? And, what has been your experience through this journey when it comes to men and infertility?
So, Lisa,
Yeah.
I want to tell you something that will surprise you.
Mm-hmm.
Men and women actually contribute equally to the problem of infertility.
Mm-hmm.
Women contribute about 30% of the problem.
Mm-hmm.
Men contribute 30% of the problem.
Mm-hmm.
30% of the problem is contributed by both of them. Okay? And I can extrapolate or expound on that. That when they are together, for a number of reasons, they might not be able to conceive. For example, I have my partner and I have to go and work up country or out of the country. And we don't meet regularly. So that is a couple problem.
Yeah.
It is for both of you. If you don't meet regularly, you can't conceive.
You miss ovulation.
You miss ovulation. You come over the weekend.
Ovulation
ovulation doesn't only occur on weekends.
You're right.
It might occur on a Wednesday. And so you say, I'm always at home over the weekends. But that's not the time.
Yeah.
Some people do not give their partners that care that they will need to make sure that they have sex regularly. Okay? If you get what I mean.
I
so
know.
you need to make sure that someone wants to do what. Because if they don't look forward to being together, then it might be a little bit difficult. People start avoiding, being with their partners because they are dreading that moment.
The moment.
You see, you come back, you're smelling alcohol, and that type of stuff.
Stress.
Okay, stress and all that type of stuff. And then the 10% that I left there is what we say we actually don't know what is causing it. You might be with a partner, we do all the checks, we find that everything is okay, you're ovulating, your uterus is okay, the tubes are fine, the man has sperm, but then you can't conceive. There are sometimes when some ladies might produce antibodies against their husband's sperm.
Aye.
And all the sperms, when they reach the cervix is the gateway to the womb, they're killed.
What's that?
Well, your body reacts to this one.
To that particular sperm.
That particular person.
But then if it's another kind of person, it works.
Yes. Now, we do not tell you to leave your partner because there is a solution. We have a solution.
Okay.
So don't say we're incompatible because, this and that.
Yeah.
Now that there's a solution, there are some antibodies, and the good thing is that they only produce at the cervix. That is the entrance. So we can bypass the cervix and put the sperms above the cervix.
Hold on,
Yes.
Dr. Mark, before you go.
Yes.
You are still, before you go forward, you are still talking about the men.
Yes.
You're saying we are equally responsible for this thing.
Yes.
What are some of those things in the, that cause male infertility? Because we don't know sometimes, and the men also don't know.
Okay.
Is it that there is no sperm, or what's that?
All right. So the first check for a man is to make sure that they can produce sperm. When they can produce sperm, then you can know that then you look at a number of factors. You look at the number of sperms, you look at how they are moving and what their shapes are. So that usually helps you to know that someone can conceive. So there's a particular number. We have a criteria that we say that this number of sperms, you can be able to conceive. If it goes below a particular number, then you might need help. If it is so low, then you might need extra help. But there are those that do not completely have sperm.
Wow.
So that is where now we start doing the investigations. As I said previously when I was starting, the problems can be up, can be down in the testis, can be on the action itself. So you might get a problem. For example, you get obstruction of the small duct that brings sperm from the testis to come out, to join other fluids like from the prostate. You might find that that duct is blocked. We call it obstructive azoospermia. Someone does not produce sperm because there's an obstruction. But also our lifestyle, especially for the men, lifestyle. Things about alcohol, excess alcohol intake, hard liquor, things about smoking, things about contact sports is also very, very, you need to make sure that you protect.
Is that why the footballers are always covering?
When they're waiting for a penalty.
Yes.
They have to do this. It sometimes comes as an instinct.
Yeah.
But I think that's our primitive nature. We need to protect
that area.
That area. And so the contact sports, for example, riding bicycles for a long period of time, produce a lot of heat. use of laptops, put them on your
Phones ever near
yeah,
here.
yes, and a lot of other things. So our lifestyles can lead to a lot of challenges in conception. Of course, we don't forget the diseases like diabetes, hypertension. Some drugs that people use, for example, to treat some of these diseases can affect sperm quality, but it can also affect, for example, erection. You get erectile dysfunction. Yes.
Now that we have talked about the different causes, what can Neogenesis, do you have solutions at Neogenesis, that are going to help us on this journey?
Yes. At Neogenesis, I would say and proudly say that we have almost most of the solutions that are needed. The first most important solution is to listen to you. Listen to your story. At least make a diagnosis for you. Okay? And then we can see what treatment suits you. Okay? When we listen to the story, then we can be able to find a solution and find a solution. A lot of people sometimes come and they tell you, you know what, doctor, can you give me at least a pill to help me? That is not what we do at Neogenesis.
Yeah.
We need to first find out why aren't you able to conceive? And then we start the treatment there. And I always joke with my patients. I tell them that, that's what differentiates us
from anyone else.
From the witch doctors. They will listen to you
and just give you something.
Yeah. But for us, we have to investigate.
Why?
The listening helps me to narrow down what I think you have. But then when I do the investigations, they help me to direct me to what the problem actually is. So we have solutions from listening to you to simple medications to surgical corrections of some of the problems that might be there to complicated or what we call assisted reproductive technologies, up to even doing genetic testing. We can be able to do that.
Wow.
Yes.
So when you talk about, where does IVF fall? Because lots of people have questions around IVF, how it works, is it successful always, and things like that.
Yes. So IVF is one of the assisted reproductive technologies that are available for those couples who cannot be able to conceive. IVF initially, when it was started because of people who had problems with the tubes. That means that an egg and a sperm could not meet because the tubes are blocked.
Okay.
So the people who started that said, let's get the eggs out, get the sperms, put them together outside the body in conditions they would have actually been in when they're in the body. And then when they make a baby, we put the babies back so that the woman can carry. So that's how IVF started. Okay. But then, of course, it got other indications for the reasons that we can probably talk about in another session. But you know that IVF is not a very new thing. The first baby who was born by IVF was born in the UK and is, I think, now he was born in 1978.
What?
Yes, she's had babies of her own. Okay, she's called Louise Brown. Okay, so those are the pioneers. There are quite a number. A gentleman called Robert Edwards and another one called Steptoe. They started all this, and over the years it has been improving and improving. So IVF is one of those in the milieu of things that we can provide as a service.
Here at Neogenesis, you can do it.
Yes, we can. And so the issues about success depends on what your problem is.
Yeah.
Okay. I always tell my clients that, we work with what you give us. Give me good eggs, give me good sperm, and I'll give you a good baby. If there's a problem with your eggs and the sperms, I have to work with what you give me. Okay. So your chances are much lower if you have a problem. Natural selection would not have allowed those people to have a baby.
Yeah.
But we are trying to make sure that everyone at least has a baby. Okay. By using technology to help them. So if everything is kept constant and normal, that you have good eggs, maybe the problem are the tubes, good eggs, good sperms, I can guarantee you that IVF will always work for you. If you control for other things, your lab is very good, the people that you work with are very good, and I'm very, very proud of the people who we work with at Neogenesis. They're doing a very great job.
Yes. So what I'm hearing from you is that you've said, give me good egg, give me good sperm. That means even me as the person, I have a lot of input. The things I may be eating because I don't know what produces good egg.
Yes.
It has to be, I have a role to play.
Exactly.
Not only just coming and saying IVF is not working.
Exactly.
Ah.
And for the ladies, something that I thought I would not leave is that your age is the biggest contributor.
Tell us more.
The issues of fertility.
Mm.
You know, when a woman reaches 35 years, your fertility reduces by about a third.
Wow.
When you enter 40, that is more markedly decelerates. I mean, the chances of conceiving markedly reduce when you enter 40 years. There's something that there's a poster that we have probably, which I would share at one point, is that when you reach 35 years, your chances of conceiving with IVF is roughly about 35%.
What?
When you enter 40, it goes to about 20%. When you enter 45, your chances with your own eggs is almost zero. Is almost zero. And that is well-known literature. It's been published. So the issue that I'm bringing forward is that have the babies or seek care as soon as possible. Do not wait to complete the PhDs and whatever, then you come, because at the end of the day, it might be very late. Maybe have your eggs stored.
Yeah, I was going to say, what can we do?
Yes, we can store the eggs, we can store the
Here at Neogenesis?
Yes, we can.
In Uganda, you store eggs?
Yes, we can.
Wow.
Regulation, world over, allows us to do that for 10 years, but we can do that for you for 10 years. So the issue is that you need to seek care early. If you have, people need to live life. You need to move the world, go places, but make sure that if you really think you would want to have a baby,
if that's in your plan,
it's in your plan. Have your eggs stored, enjoy your life. Come back and see me at 43, 44 years.
Wow.
And we'll sort you out with your 23-year-old eggs.
Yes. Amazing.
Yes.
Now, you talked about, having a role to play, and sometimes some people things have really failed. We have heard of the option of surrogacy. Is it an option, first of all, and can it be done? We see these things in movies.
Yes, surrogacy is a very, very good part of the services that are offered in fertility centers.
Yes.
Now, this is what we call as third-party reproduction. So you have someone else who's going to help you to carry your baby. There are those ladies that might, unfortunately, get some challenges and they cannot be able to have babies. For example, I had a couple on their first baby who unfortunately died. They conceived well, had a baby, and during delivery, the lady had a lot of bleeding. And by the time they removed the baby was already dead, but they also couldn't save the uterus. So to save the mother's life, the doctor rightly made a decision to remove the lady's uterus to save her life, because the uterus can refuse to contract and you can bleed to death.
Okay.
So that type of couple can come to you and they want to have a baby. Or someone has had a number of seizures, for example, 4 seizures, and we feel that it might be very risky for you to carry a baby for yourself and have another seizure. But probably the 4 seizures you've had, maybe you have no living child. Things happen. People lose babies. People lose children. And you still want to have a baby. So someone else who is a volunteer can come and say, you know what, I can be able to help
Carry
you.
for you.
Carry for you your baby. The womb or the uterus is a vessel to feed the baby and carry the baby. That's all.
A vessel.
It's a vessel.
Wow.
It's something that helps you to carry the baby and feed the baby. So the person who's caring for you, the baby, does not add anything on the DNA or the makeup, the genetic makeup of your children. So these are people who have a very big heart, I would say. What their contribution to fertility treatment is priceless. To help someone else
go
through
the 9 months.
The 9 months.
Yes.
The vomiting. The what? And you help these mothers. They really have a big heart. And so yes, it's something that we can use. And it's available.
Is it available here?
Yes, it's available at Neogenesis.
Guys, are you hearing? The options are endless. If you feel like something may be wrong, don't sit back with the myths and assumptions. Come to the expert so that they can actually see and understand what the problem is, so they can solve it. All right. So, what advice would you give someone out there who is struggling? What maybe top 3 things would you tell them, or whatever advice you'd give them?
So, Lisa, the first advice I would give people is that if you feel that you want to have a baby, even those ones who are just planning to have children, and they're planning, you should come and see a doctor. There are some things that you can do to correct some of the problems that you might have before you even know you have them.
Oh, yes.
Okay? So you come and we see you. So we talk to you and be able to see how we can help. The second thing is that do not take a lot of time waiting to eventually come when you're 40, 45, 50 years to have a baby. Come early, okay? Come when you're still young, 35 years and below, and your help is much, much better at that time. You know, your reproductive life doesn't wait for you.
Yeah.
They always say that, you know, the 40 is the new 30. That's what people usually say.
Yeah.
But that's actually not true. Your biological clock is ticking. By the time you reach 35, you are the Rubicon of your reproduction.
Yeah.
At that time when it's downhill with the reproduction. So let them come. Yes, follow your dreams. You know, enjoy life, travel the world. But please, if you want to have a baby, come and have your garments stored, and then you can do the rest that you want to do with your life. And then after that, you can come and have children.
Okay.
Yes.
So if you've walked the journey with me and I'm now pregnant, etc., do you walk this journey with me now through the pregnancy, or you stop at the fertility and I've gotten pregnant and then I go?
So we have a team of experts who we work with. We have, as I told you, our training initially are obstetricians and gynecologists at the start. So we have people who handle. We work first and foremost the general with antenatal. We do it for you. And then after that, we can also conduct your delivery and even the delivery and even your care after the postnatal period. So we have a team of people that we work with. I might be very good at what I do in terms of trying to help you conceive. There are other people who we work with as a team who are very good at walking you the journey of pregnancy and also do your delivery and then see you through the postnatal period. So we have a good team that can do everything.
So I see that Neogenesis is a wholesome place.
Yes.
We've talked to psychologists. We've seen that it begins with the mind, and then you guys work on the body. So it's a wholesome situation. So if you feel like you're struggling, please come and see an expert. I hope you've enjoyed the session. Let us know in the comment section. Is there any question you've answered? We'll be ready to answer it, maybe in the next session. Thank you so much, Dr. Mark.
You're welcome, Lisa, and thanks for having me.
Thank you for being here. My name is Lisa Kusima, guys, and I'm here to inspire.